My name is Thilly Mokete, and I belong to Saopa. And Saopa is one of those bodies that are concerned with health education. And in the team, I am a mental health care professional. Today, I'm going to be talking to you about cancer and mental health. Cancer brings a physical hardship and affects mental health well-being of patients. Remember that Dr. Nolwazi spoke about cancer of the breast, I think on Monday or so, and we will be talking about cancer throughout this week, as it was National Cancer Day, but now we say it's National Cancer Month for the whole month of October. So patients experience a variety of emotions, and these emotions, differ from one patient to the other, and they can range from anxiety, grief, isolation, and very serious depression, leading to some patients committing suicide. So because we're talking about cancer and mental health, it's cancer in general, but now I'm going to be walking side by side or together with what Doctor presented on Monday, that is cancer of the breast. So mental health and breast cancer. Breast cancer affects a lot of females, maybe 99% of females. There are males that are being affected by cancer, but as it is commonly known to be affecting females, we will concentrate on cancer of the breast of females. So the diagnosis of cancer of the breast can impact on one's mental health. Patients experience a lot of different emotions after being told that you have got cancer of the breast. So they eventually face depression. They are anxious. They don't know what is going to happen next. They don't know what questions to ask. They get panic attacks or PTSD. I'm going to go into each of these emotions, each of these feelings that patients experience, taking them one by one. Let's start off with depression, clinical depression. What is clinical depression? It is an emotional roller coaster. It is a feeling. It is the sign that a client exhibits that lasts for 2 or more weeks, where an individual has got changes in their appetite or changes in weight and they lose weight. They become very sad or they lose interest in things that they used to do on a daily basis. The things that they used to take pleasure in, they don't like anymore. They develop feelings of guilt that perhaps I should have gone for my mammogram, or I missed my mammogram, or I was told that there is cancer in the family and I never went for breast mammography, or I felt a lump and I disregarded it. They show lack of or poor concentration. They have got frequent thoughts of death or suicide. They are always confused. They don't know what to do. And let's look at anxiety, generalized anxiety. They are always tired. They experience fatigue. They've got trouble concentrating. So you can imagine one could be in a very high position in a a setting or a place where she is a leader, and if she has got trouble concentrating, it is a problem. If she has got trouble concentrating and she's always tired and she's a mother or she's a partner or a wife to someone, then they experience this generalized anxiety because they are aware of what is happening. They can become irritable very easily. They've got sore muscles, especially if they are going to be undergoing chemotherapy. They are always tired. They are sore all the time. If it's a young mother, she can't play with her little ones. If it's somebody that has got to be doing that kind of work where they are always active and doing that, they are unable to do what they used to do. They sleep poorly, or they have got what we call insomnia. Many hours of poor sleep or lack of sleep. Okay. Let's look at panic attacks, because we said these people develop panic attacks. We've just been told, just been given the diagnosis that you've got breast cancer. They develop intense fear. Am I going to die? They ask questions, why me? They ask questions, what's going to happen to my kids? They ask questions, what's going to happen to my business? They ask questions, am I going to go back to work? They've got a racing heart rate. At times it's even pounding. They sweat. They've got shortness of breath. They can't breathe easily. And the more they develop these panic attacks and they are aware of them, the more they cannot control them. They feel nauseous, especially once they start going on treatment. They feel nauseous. They don't want to eat. They develop chest pains. Remember, breast tissue is in the chest. It can be one breast, it can be both breasts. They are dizzy most of the time. They are trembling. The minute they start to experience this heart that is racing, the fast pulse rate, then they start trembling and they sweat and they are dizzy most of the time. And then let's have a look at post-traumatic stress disorder, PTSD. Patients that have just been given a diagnosis of breast cancer might develop post-traumatic stress disorder. Perhaps it was one breast and now it's another breast. And now they start thinking of what happened the first time that they were giving the diagnosis of breast cancer. Or alternately, they could have flashbacks of very terrible memories of somebody that passed on with breast cancer. and then they start feeling numb and detached. They easily become angry, experience sudden fits of anger. Because you can imagine this is very traumatizing. I've got this pink, purplish, very beautiful picture of a female upper torso or upper body where the breast has been removed, probably during surgery because of breast cancer. When we go around, when we speak on radio, when we speak on TV, we speak about the body that is changing. And all these women with cancer of the breast, they know what changes occur to their bodies. They experience it even more. They are the ones that are hands-on with the changes of body image. Hence, they feel, less of the real people that they used to be. They feel dizzy. They feel unacceptable. They sweat. They even don't want to meet other people. They change their bodies. If she has to go and buy or purchase a bra, they struggle to get the right bra. So with change body image, they have to adapt to quite a number of things that they have to do. Quite a number. The shopping of the bra is a problem to them. Whilst to those of us that still have both breasts, we don't have a problem. Okay. All right. Now let's look at ways of supporting them, supporting the loved ones when they have got cancer of the breast. Loved ones as well as friends. Let's help them cope with cancer of the breast, either the diagnosis or whilst they are undergoing different models of treatment, which doctors spoke about. Love. If we give them love, unconditional love, then they are able to cope. Let's not pretend. Let's give them love, copious amounts of love. And let's be empathetic to them. If we are empathetic and not sympathetic, then we walk with them. We put our feet into their shoes and we walk the same steps with them. Then they will feel it. We cannot hide it. Neither can we pretend or play around with empathy. They will pick it up immediately. Be empathetic. Smile. If you smile to a friend, a loved one, a family member with cancer, the minute they maybe come out of surgery or you're visiting them in a hospital, a smile says a lot of words. A smile can travel the whole world. A smile communicates a lot. So smile. Go into communication. Let us communicate with the people that have got breast cancer in a way that we're not going to be, showering them with our shame, I'm sorry, this, that. Communicate openly with a person that has got cancer. Listen to them first before you can try and offer whatever means of communication that you want to, but do something. Positivity. If you are aware and you are 100% sure of the caregivers around this individual, be they the doctors, the oncologists, because there's a team, a whole host of about 10 individuals, professionals that will be communicating with these individuals. You also one of them. Do not speak negatively of them. And especially if you know that this is a big institution and perhaps you have heard of this doctor and that nurse and that oncologist and that psychiatrist or that care worker, communicate positive information to them, like you are in good hands, without you saying you are in good hands and not knowing the people that are giving care to this information. The family, if it's the family that are looking after this individual, empower the family, speak positive information, send positive information and feelings to them. Practical help. How can we offer practical help? If you're visiting a client or a patient, a friend, family member who has had surgery, they are lying in hospital, see to it that you go to them and maybe you communicate with them first that I'll be coming, so that the person can say yes, or perhaps there's somebody that is coming, or the minute you say I am coming on Thursday at 10, be there at 10. They need help. Help like maybe bills have to be paid, but because she's lying in hospital, she can't do that. Perhaps she's home. Still, she can't walk. She can't take public transport. Offer practical help. I'll come and pick you up on such and such a day so that we go to the park. Or I'll come and pick you up. Do you feel like going to the movie? It's your friend that perhaps you've known. And then you go to the movie together and have good old days, of eating popcorn in the movie. Or perhaps I'll see to it that I'll come and hang out the laundry for you from the washing machine. Offer practical help. Don't freeze or disappear as a friend or family member, because if we abandon these cancer patients, then we are saying to them, you are doomed. We are saying to them, we cannot be with you. You are going to be isolated for the rest of your life. So be their friend in order to be their bridge, because they need you in order to cross over to the next life, in order to understand what they should be doing. Don't freeze or disappear. Touch them, because cancer is not contagious. With family and friends, with hope and faith, I am a survivor. This is what the patient with cancer would say. They have got so much belief in us. They believe in us. The hope that we are going to be assisting them, so that tomorrow they are saying they are survivors. And they can only be survivors. They can only be survivors if we give them that love, if we show them that empathy, if we walk the same steps with them, if we see to it that we help as much as possible, and we don't just walk in and say, how can I help? No, offer practical little steps of help. I thank you.